Vulnerability refers to those who have an increased risk to adverse health outcomes. Vulnerable populations are more likely to develop health-related problems due to issues such as inability to access proper health care and are more likely to experience a shorter lifespan or a poorer health outcome than others. There are many populations that are considered vulnerable. One of these is the elderly. While advanced age itself does not create vulnerability, certain problems that are more common with older age can increase vulnerability. Older adults have a higher prevalence of chronic conditions such as diabetes, high cholesterol, and hypertension. Additionally, many older adults have physical disabilities and cognitive impairments and face potential limitations in their mobility, as well as access to proper transportation. Furthermore, in addition to chronic health conditions, many older adults have multiple health conditions that may require daily medications or specialized equipment. If this population is unable to access the special care that they need, they are at an increased risk of complications and death. Economically, the elderly is considered a vulnerable population because their health can be negatively affected by their lack of income. Most older adults do not work and have limited options to earn income. Some older adults have only Social Security benefits as their sole source of income and can only afford substandard care as a result. A risk assessment is used to identify, analyze, and evaluate risks that may have a negative influence on the quality and safety of patient care. Risk assessments lead to more appropriate decision-making and consequently improve the quality and safety of patient care. A risk assessment of the elderly is used to assess risk factors by these persons and to develop interventions and strategies to manage these identified risks. Risks that should be considered in an assessment of the elderly population include isolation, falls, malnutrition, depression, medication, and abuse. With increased life expectancy, a rise in cost of living expenses, and increased healthcare costs, many older adults are outliving their financial resources, putting them at an even further risk of being vulnerable. One nursing theory that fits an advanced health assessment to meet the needs of the aging population is Betty Newman's systems model. This model is a nursing theory that views patients in a holistic manner. Holistic nursing care focuses on addressing the whole person, including their physical, mental, and emotional health. This theory is based on a person's relationship and response to stress and focuses on the patient system's response to actual or perceived emotional stressors and helps to maintain the patient's well-being. Newman's theory contains three basic parts: nursing diagnosis, nursing goals, and nursing outcomes. These goals and outcomes can be achieved through primary, secondary, and tertiary prevention interventions. Primary prevention is the first level of health care. It reduces the risk of disease before it starts by eliminating or reducing risk factors. This can include things such as flu and pneumonia vaccines. Secondary prevention includes screening for disease progression and taking preventative measures to limit further complications. Screening programs are one of the best tools for risk assessment. Some screening programs that can be used for the elderly include breast cancer screening, cervical cancer screening, and colon cancer screening. Finally, tertiary prevention reduces the symptoms of a disease someone already has and tries to improve their quality of life. This can include things such as inpatient therapy for a patient who has suffered from a stroke. By using these three types of prevention, nurses can use the data collected to complete an advanced health assessment for their patients. There are many ethical, cultural, spiritual, environmental, and community and home health advanced assessment needs of the elderly. Ageism refers to negative attitudes based on someone's age, including age-based stereotypes, discrimination, and negative feelings. Medical professionals may minimize the severity of an elderly person's concerns, attributing them to signs of old age. This can lead to patients being undertreated. Ageism can also be demonstrated when clinicians speak to the elderly There are also cultural and spiritual needs of the elderly. Nurses need to ensure that they are providing culturally appropriate care to their patients. This is specifically true for the elderly population. A patient's cultural and spiritual needs become particularly important when it comes to ill health. Perceptions of elderly patients may differ according to cultural customs. Some cultures may respect their oldest members, while others may see them as incompetent, thus increasing the risk of elder abuse. Elder abuse can lead to physical harm, adverse effects to psychological health, early death, and devastating financial loss. Older patients may even face risks such as neglect and abandonment. The spiritual needs of this population must also be assessed. Spirituality can influence a person's coping and ability to recover from illness. Patients who are spiritual may use their beliefs to cope. Environmental factors may impact an older person's quality of life. One example is housing. Housing is a social determinant of health. A safe home can promote well-being, while an unsafe living environment may contribute to health inequalities, including chronic diseases. Poor housing may also lead to exposure of potential health hazards, which can lead to many preventable conditions such as respiratory and cardiovascular illness and even cancer. Furthermore, low-quality home equipment such as heating and plumbing may increase the exposure to carbon monoxide and airborne illness. It is important for nurses to assess a patient's living condition to identify both safety and health risks. It is also important for the nurse to assess an elderly person's access to community-based services. There are common problems that make the elderly a vulnerable population. Older adults may face chronic illnesses such as diabetes and hypertension, as well as physical disabilities and cognitive impairment. Newman's systems model can be used to provide holistic care to this population and can help address the ethical, spiritual, environmental, community, and home health needs of the elderly.